Well, today discussion is with Dr. Claire Merrifield and all about the endocrine system. And we're really going to focus on kind of the structure and function of the system, and then maybe dispelling some things about the system and how we can make systems thrive. I mean, it's one thing to talk about different pathological conditions with different systems, but also how do we make it better? And how do we help people? And in this case, especially clients, colleagues, and other professionals. So, Dr. Merrifield, thank you so much for joining me for this.
Oh, you're very welcome. I really appreciate you having me on the show.
Most definitely. Well, let's just jump into it. So, the endocrine system, let's just start with the basics. Let's hit the basics first, because I think, as you and I were discussing, that a lot of people jump into more complicated issues, but let's hit the basics first on this system.
Yeah, so I think to start with, let's talk. The endocrine system is essentially a series of glands which are in various organs and structures of the body, which produce hormones. So if we start to think about what hormones are first, so the hormones are chemical messengers. Okay, that's all they do. They tell one part of the body to do something. So we've got the endocrine system is one of our main communication systems in the body. We also have our nervous system. And they do work together, so it's important to just mention the nervous system briefly. Now, the nervous system is kind of how we interact with the world directly, so it's how we see something, and we might move away from something that's coming towards us quickly, or we might touch a hot stove and move away quickly. The endocrine system is a slower system than that. You can think of it almost like posting a letter rather than sending an email. So we have hormones that are produced in various parts of the body that move around in the bloodstream and communicate with different parts of the body, telling it what to do. Now, it's really fascinating kind of revising this topic for this show, because it just makes you realize how amazingly complicated and wonderful the body is and how things work, right? So some hormones aren't just produced by one part of the endocrine system. I think that's really important to know. So some hormones can be produced by different parts of the body. Hormones work on different parts of the body, so they may not just work on one part of the body to do one thing. And hormones interact with each other. So one hormone might tell another gland to produce a hormone, which might then tell another gland to produce another hormone, which might then tell the original gland to stop producing that hormone to sort of start the chain, if that makes sense. So just wanted to lay out a little bit about the complexity of hormones and hormonal control before we kind of get started. So I thought I'd talk about the endocrine system from top to bottom. That's just one of the easiest ways I can think of to explain it. So actually, a lot of our hormones are produced, or the signal to produce them is in the brain. So the hypothalamus is an area of the brain. You can think of that almost like our control center, our thermostat of the brain. So it regulates things like our temperature, our mood, our libido, whether we're hungry, thirsty, whether we feel full and stop eating. So it's a really, really important part of the brain, and lots of the signals that produce hormones in the rest of the body come from there. In particular, our stress hormones, our sex hormones, and our thyroid hormones, which really regulate all of our metabolism. So your hypothalamus sits within your brain. It's attached by a little stalk to a gland called your pituitary gland. Now, that's a little pea-sized gland that sits just behind your the bridge of your nose, behind your eyebrows. And I'm talking about where it is because it actually sits directly below your nerves that conduct your vision to your brain, so your optic nerves. Now, I don't know if you know, but your left eye connects to the right side of your brain and your right eye connects to the left side of your brain. So your nerves that go from the back of your eye actually cross over. And there's a point that cross, which is directly on top of where the pituitary gland sits. And that's relevant because quite a lot of the time, problems with hormones can stem from growths in that pituitary gland. And that can cause problems with our vision. So if you ever notice anybody say that they've got things like tunnel vision, or they're noticing gaps in their vision, that's just a really important sign to get checked out, making sure you get your visual fields checked, and possibly asking your doctor for some blood work. Okay, so your pituitary gland is really important. So that produces hormones which tell other glands to produce hormones for the most part. The exception to that is prolactin, which is a hormone that tells breastfeeding mothers to produce milk, basically. So moving down, we then have our thyroid gland. Now that's a butterfly-shaped gland that sits at the base of your neck, just above your collarbone. It produces thyroid hormone. So thyroid hormones, if you've heard of them, they are your main metabolic regulator. So they work on pretty much every cell in the body and tell it essentially how fast to be acting and how fast to be moving. Because of that, it's really important for generating heat and generating energy. And we can talk a bit more about thyroid hormone later, because the symptoms of problems with your thyroid are really widespread, and lots of people will have them without necessarily having problems with their thyroid hormone. We've got your hypothalamus, that area in your brain that kind of senses what's going on. That communicates with your pituitary gland. Your pituitary gland then communicates with your thyroid to produce thyroid hormone. At the back of your thyroid gland, you've got 4 little glands called your parathyroid glands. These have nothing to do with your thyroid hormones at all. They actually help produce parathyroid hormone, which is related to calcium balance in the blood. Calcium is really important for muscle contraction, so in particularly important for things like your heart's beating. So it's really important to make sure your levels of calcium are stable, and your parathyroid hormones will produce a hormone called parathyroid hormone. Sorry, parathyroid glands will produce parathyroid hormone, which tells the rest of the body to release and absorb calcium. Then if we move down the body, we've got quite a lot going on with the endocrine system in the abdomen. So the gut, actually, although we tend to think of the gut mainly as being related to digesting and absorbing food, part of the way it does that is by endocrine action. So we have enteroendocrine cells. They are cells within the gut, the gastrointestinal tract, that tell our body to do various things related to metabolizing food. So in response to having glucose or amino acids or fats, they will signal to different parts of the gastrointestinal tract to do different things. For example, if you have a load of fat that comes through into the small intestine, that will produce a hormone called cholecystokinin, which tells the gallbladder to contract and squirt a load of bile into the small intestine. That's really important for absorbing fat. Now, you probably heard of a lot of gastric peptides, because we've spoken, because lots of people are taking medication now like Wegovy and Mounjaro. Now, they are basically fake synthetic versions of some of our gastric hormones that make us feel full. So they're really effective in weight loss. Okay. So there's lots of different cells within the gastrointestinal tract which produce various different hormones which are really important for digesting and absorbing our food. Another really important organ is the pancreas, which sits kind of behind the gastrointestinal tract. The main hormone that produces is insulin. So that will produce insulin in response to glucose levels in the blood. So if glucose levels go high, we produce insulin. The insulin tells muscle cells and the liver cells to take that glucose out of the bloodstream. Then when glucose levels fall, that stops the insulin being produced anymore. Now, there's hormones within the gastrointestinal tract that as soon as they sense carbohydrate or glucose will actually also tell the pancreas to produce insulin. So it's almost pre-advising the pancreas that we're about to have a meal. So that can really help with reducing spikes of blood sugar. We've also have the kidneys. So these are 2 bean-shaped organs that sit at the back of our rib cage. Most people know about the kidneys for producing urine, so our waste product, but they're also quite important for producing hormones. And they produce really three main hormones. So one of which is actually related to calcium balance. So when we, so it actually activates vitamin D in the kidney. So when we have low levels of calcium, it signals our parathyroid gland to produce parathyroid hormone. That then tells our kidneys to turn vitamin D, which we'll produce in our skin from the sun or take as a supplement. It will tell our kidneys to activate that vitamin D. Now, active vitamin D is a hormone that then tells the intestine to absorb more calcium. So it's quite a clever mechanism with multiple different hormones at play. You've probably also heard of EPO, but that's produced by the kidneys. So that is erythropoietin. So that is a hormone that tells the bone marrow to produce more red blood cells. Now, it will do that normally in response to not having enough red blood cells or oxygen in the body from conditions like anemia or being at altitude. But we may have heard of it, or your listeners may have heard of it, because some people you tend to use it for doping. So elite cyclists, for example, use EPO as a doping agent to increase their red blood cells and increase their efficiency. It has a negative potential side effect that it can make the blood very thick and predispose it to blood clots. And unfortunately, that has happened with some elite athletes. So it's just a kind of warning of how important hormones can be and what can happen if we take them inappropriately. Now, on top of your kidneys, you have your adrenal glands. So those are really important for producing your stress hormones. So they produce adrenaline, which you get in your fight or flight response, and cortisol, which is your longer acting stress hormone. Cortisol is really important in general in the body for daily regulation, but we know that excess prolonged cortisol due to unrelenting stress causes a lot of problems with the rest of the body, partially because of its interaction with other hormones. So we've gone down most of the body. We've got the sex hormones, the last main bits to talk about. So men, the primary sex hormone in men is testosterone, and that's produced by the testicles in response to signals from the pituitary gland, in response to signals from the hypothalamus. Okay, so testosterone, probably lots of your listeners will know, but it's a very important hormone in men. It's important for muscle building, energy, libido, and it can gradually decrease as we age, and often men might replace it when they get older if they're experiencing symptoms or if their testosterone levels are low. Women, lots of their sex hormone is produced by their ovaries. So women of childbearing age will produce estrogen and progesterone in response to signals from the pituitary gland, in quite a complicated dance throughout their menstrual cycles. We don't have to go into that in detail, but suffice to say that it's very important for fertility. Obviously, we have to kind of coordinate releasing an egg at certain times of the month, and estrogen is important for lots of other functions like bone health and cardiovascular health as well. Now, we've sort of talked through most of the major glands in the body, but it's worth also mentioning something that we didn't used to know about, which is that fat is a really important part of the endocrine system. Now, we used to sort of think that fat was pretty much inert, just a kind of storage unit for energy. But we now know that fat is extremely metabolically active. There's different types of fat, brown and white fat. White fat's much less metabolically active. But it's important to know that fat produces hormones, and those hormones regulate appetite and other things. So our fat produces something called leptin, which makes us feel full. So theoretically, the more fat you have, the more full you feel, and so the less you tend to eat. But unfortunately, in conditions like obesity, where people have lots and lots of fat cells, they produce so much leptin that then they stop responding to the signals of the leptin and end up essentially overeating or not realizing that they don't need to eat. So it's quite an interesting system that is very, very delicately balanced. So hopefully I've given you a bit of a general tour through the body of the endocrine system. I know there's a lot. I mean, there's well over 50 hormones. We won't go into it more in detail, but just to give you a bit of a flavor of the complexity of it.
Gosh, that was fantastic, Dr. Merrifield. Really appreciate that. And all the folks who are going to listen to this are very appreciative, I guarantee you, for going down through there. So let's go back through. There's a lot to digest there. And the way I want to digest this is going through probably what's more common to most students, professionals, colleagues. Let's talk about the thyroid gland. So I can't tell you how many times I've heard of clients talk to me about the lack of functioning in their thyroid gland, and that this is a very large problem in terms of weight loss and different conditions related to that. So, in your experience and in your education, how much of a role is this playing in terms of weight loss? And reality, I guess, I mean, I think there's just so much information with this, and how much can we attribute not having significant weight loss to thyroid dysfunction?
Yeah, that's a great question. And it's so interesting, isn't it? Because when I was learning about the thyroid gland as a medical student, I remember looking at the symptoms of low functioning thyroid, which, just for the benefit of your audience, if your thyroid's not working, you typically feel tired, it's hard to lose weight, or you're sort of putting on weight and you don't really want to. Sometimes you're a bit constipated, often feel a bit cold. Sometimes your skin is a bit dry, your hair might be a bit lackluster. Lots of sort of very vague symptoms that lots of people had. And I was 100% convinced that I had low thyroid. I was like, this is why I don't feel great and why I'm not skinny mini. And lo and behold, I tested my thyroid is perfect thyroid function. And I think it's extremely common that people will read a laundry list of things that, you know, a low thyroid hormone cause and think, well, that must be it. And often they have a perfectly normal thyroid. It is a common cause of endocrine dysfunction, and it tends to get more common as you get older. It's more common in women. So sort of around 40s to 50, that can be as often as 10% of women. So it is really important, particularly women who are kind of around perimenopausal age. It's very, very important to check your thyroid levels, because sometimes the symptoms of perimenopause can get confused with low thyroid. So it's important in that age group. It tends to be less common in younger people, but it can happen. And I do recommend that people check their thyroid on a regular basis because it's so common. However, if you tested your thyroid and it's fine, it's very unlikely that that's the cause of your problems. There are lots of other things that affect weight loss that are nothing to do with that. And I think we're often looking for a quick fix or a pill that can help us. You know, I'm not immune to that. I think we all want that, don't we? But particularly when it comes to weight loss, it's not an easy thing to do. But yeah, I think we sometimes over attribute problems with thyroid to that.
Yeah, again, I don't want this to sound like I'm saying that this is, just everyone thinks they have a thyroid issue, but just in my practice over 20 something years, it's probably the most common hormonal issue to discuss, along with what we will discuss, is sex-based hormones as well, which is getting a lot of publicity, especially during perimenopause, menopause, things of that nature. But just a lot of attribution of lack of weight loss to the thyroid, lack of thyroid functioning, and that this is why this isn't happening, versus looking at, a pantheon of effects of things and modifiable lifestyle behaviors for that. So in the same element, when talking about low functioning thyroid, what are some things that can be done to increase the functioning of the thyroid so that it's more optimized versus even just being normal? What can we do for that?
So, I mean, I think the reality is that if you actually have a problem with your thyroid glands such that it isn't producing enough thyroid hormone, usually you need to actually take medication to solve that. You know, if you have an autoimmune condition, which is the most common reason for people in the West to have low functioning thyroid, then you need to take a replacement. There isn't really an alternative for that. There are things that we can do in our lifestyles to support a healthy thyroid function, but that's all it does, is support our natural function. It's not going to increase your thyroid levels if you don't have a problem. And so, nutrition is really important for thyroid function, because the thyroid needs quite a few different things in order to produce thyroid hormone, particularly elements like iodine, selenium, magnesium, and those are typically present in a diet where you have quite a whole food diet, where you include meat, dairy, fish, nuts and legumes into your diet. If you have a very restrictive diet, then or you're a vegan, it might be worth supplementing, so taking just a standard multivitamin supplement, and possibly even protein supplements to make sure that you've got enough kind of building blocks for your thyroid hormone. But it's certainly not necessary to go on a really extreme diet for it. I think a lot of people are aware that iodine is important for thyroid function, and sometimes they might take supplements which contain iodine, but that's actually a really bad idea, because too much iodine inhibits thyroid hormone production in a similar way to not enough. So we have to be really careful with the amount of iodine that we have, and things like seaweed supplements can actually be quite dangerous or cause problems with the thyroid. Now, it's very easy for people to come up with a specific thyroid health plan or something along those lines, and I struggle with that a bit, because we can do things, as I've said, to optimize our body's own production of it, but there's not a huge amount else that we can do to kind of maximize the production. I mean, I don't know what your experience of that is, or what you've found people doing.
No, I mean,
optimize
I
function.
would say most of my clients who have had, thyroid dysfunction are on medication for
Yeah.
that. So I was just curious from your point of view,
Yeah.
what were some other
Yeah.
ideas about it? But as I think, the point of this is to really get solid information out
Yeah.
there. There's just so much misinformation about different hormonal levels, and people throw the word hormone out very just casually.
Yeah.
Oh, this hormones. Oh, it's my hormones. This is hormone. This hormone. And say, okay, well, let's discuss what these hormones actually do for that. And so before we move on to the next thing about cortisol, because again, another common discussion when we have stress, cortisol, what's maybe the biggest, I guess you could say, misinformation related to the thyroid that you hear, or you're like, well, this is not accurate information related to thyroid.
That's a good question. I think some people are slightly mistrustful of thyroid function testing, even though we know it's very good. And I think that's because lots of people experience the symptoms of low thyroid without it being caused by the thyroid. And I think there's potentially a desire, as we've said, for there to be a problem to fix, for there to be a hormone that's out of balance that we can correct. Probably that's one of them. And I don't know, I hear this term a lot on social media, the idea that we can balance hormone and that we have a lot of control over these things. And the reality is that if we have a condition that affects our ability to produce thyroid hormone, there's not a huge amount that we can do about it other than take medication, and that's okay, and the medication works and it's good and it sort of improves people's lives. So I think we have to be mindful of how much control we actually have over a lot of these conditions.
Do you ever run into any issues with people who are resistant about medication for any of these things?
Yeah. Yes. Yeah. And yeah, it's a problem because it really does affect a lot of your life. And what's, something that's quite a common condition is called subclinical hypothyroidism. I don't know if your parents have ever mentioned anything like that. So this is a condition where, so essentially the hormone chain in the brain works that you have TSH, thyroid stimulating hormone, is produced by your pituitary gland. That then tells your thyroid hormone to produce thyroxine. When you have enough thyroxine in your blood, that tells the pituitary gland to stop producing TSH. Okay, so in a normal person who has good thyroid levels, you will have a relatively low level of TSH and a relatively high level of thyroid hormone T3, T4. When we do testing, we usually test both TSH and T3, T4. Now, somebody who's got proper problems with their thyroid, so really low thyroid, they will have a high TSH and a low thyroid hormone. So the thyroid hormone isn't telling the pituitary to stop producing TSH. So that's a definite. You've got low functioning thyroid hormone. Thyroids, you need medications. But we also see something which is probably a precursor to full-blown hypothyroidism, which is where you have a normal level of thyroid hormone, but high levels of TSH. So the thyroid hormone almost isn't working properly to tell the pituitary gland to stop stimulating the thyroid gland, if that makes sense. Now, that's quite a difficult thing to treat, because what we typically say to patients, if that's really high, then we would do a trial of treatment. But if it's only moderately high, we would only try treatment, so try taking thyroid hormone if you had symptoms, which we've explained that probably everybody has symptoms. Low thyroid. And the thing is, I think once you start taking this medication, you're pretty much taking it for life. So I think people are resistant to that idea. But it's important to be aware that the thyroid, if you do have low thyroid or borderline low thyroid, it can often develop into low thyroid problems later. And it has all sorts of implications on the rest of our body and our metabolic health. It can affect our cholesterol, so we can have high cholesterol, which then increases our risk of heart disease and things. So it is important to take it if you need it, but it's worth a trial of these things to see if that's really the cause of your symptoms.
Outstanding. Yes, I love that. No, it's great. Actually, I know several clients who are going to listen to this and be like, "Whoa!" Like, I think I think current times too. There is a faction of people who are just very resistant to any medication, and for some reason they've gotten in their mind that this is bad, medication is bad, and that everything is capable of being taken care of through ulterior means. But there are some realities to certain conditions. And so I appreciate you being very honest about that.
And what you'll find often is that those sorts of people, that camp of people, will have absolutely no problem taking all of the supplements. They will be taking powders and tablets. They'll be rattling with supplements, but a kind of pharmacological medicine they will have a problem with, which it doesn't really make sense, doesn't it? If you're kind of happy to take medication to or a supplements work often in very similar ways to lots of medicines. And I think we have to be realistic. We can do as much as we can in terms of our lifestyle, but sometimes our genetics don't allow us to be as healthy as we could be. And we've got really brilliant medications for some things that work really well. We should not be afraid of using them and not feel like a failure if we have to use them. I think that's really important. I think it's not your body failing or you failing your body. It's nothing that you've done to kind of cause this. It's just the body is extraordinarily complex. There's so many things going on all the time, and we're really, really lucky that it works well most of the time for us. So I think we need to just, take the support where it exists and where it's good, and do what we can for the rest of it.
I always tell my students especially that the body is incredible with all these homeostatic mechanisms that are trying to occur to balance these levels out, and all the different systems that are occurring in order for you to have essentially neurotypical behavior on a regular basis is astounding. It's truly astounding.
And I think we are, there's a camp of people, and this will go into sort of dispelling myths, that almost feel like it's incumbent on us to get involved in that and try and homeostasis. We've got no idea what's going on. It's complicated, and that we need to stay well alone.
It kind of reminds me of I think when the human genome was mapped, and there was a lot of excitement about, well, now we're going to be easily be able to essentially, like a light switch, turn on and turn off genes, and we're able to solve all these things. And what it did is just create more questions, and to me, create more respect into the vast complexity of what
Mhm.
has to happen, kind of the interconnectedness of all the systems together, that the system is so complex, it's almost boggling.
It's mind-boggling. And sometimes I wonder that we're actually able to comprehend it at all. And certainly, my research background is the gut microbiome. That is beyond
Yeah.
mind-boggling. There's no way we're ever going to fully understand that in our lifetime, I don't think. Um, but what's interesting about the genome is I don't know if you sort of remember this from back when you were learning about this at school, but we always used to call bits of the genome junk DNA
Yeah.
because
Yeah.
it didn't seem to code for a gene. And obviously now we know that that's really, really important. And I think our understanding of all of these things is just exploding at the moment. And I think people who haven't necessarily got the scientific or the medical background um, should be quite aware of the message that they're giving on social media if they're in a position of being an influencer or something like that, because people will listen to influencers, unfortunately, a lot more than they'll listen to scientists and doctors. And people have got a responsibility to not give misinformation out. And if you don't necessarily know what you don't know, you're dangerous in that
Yeah.
capacity.
Most definitely. I had another man, the questions just popping up here. For me, I have a quick question related to how much of the dysfunction in the endocrine system is related to heritability?
Yeah, that's a really good question. It's often not that common, in all honesty. I would say that there are a lot of genetic defects which occur within parts of the endocrine system. They're not often heritable. There are probably, you would have heard of things like thyroid disease is often heritable, but that tends to be because autoimmune disease is heritable,
Yeah.
and autoimmune disease is the most common cause of thyroid dysfunction. Um, but when you think about how complex the endocrine system is, you've got to have a gland produce a hormone, it's got to go to another gland, attach to a receptor, get into the cell, do something else, probably produce another hormone. There's all sorts of genetic defects that can happen along that route. And lots of those defects just aren't compatible with life. So we've sort of evolved quite well to not have very many hereditary endocrine issues. I'm not saying there aren't any, but I would say it's not the major thing that you think of
Right.
when you're thinking about that. It is sometimes related to genetic defects, but often just things that occur during the course of life.
So I mean, it sounds like, I don't want to put words in your mouth, but it sounds
Mhm.
like the heritability is lower, in just generally speaking.
Yeah, it's not often the case that you'll have, say, somebody. So, for example, I was just looking at this, looking through my hormonal things earlier. There was a picture of two identical twins. One of them had acromegaly, which is or gigantism, which is an overproduction of growth hormone. Um, so that's not related to genetics; they're genetically identical, but one of them has just had a spontaneous production of the growth hormone. And what you find is that in these cells that are quite complex, they're producing lots, they're doing a lot. They can just start overproducing things. Just by themselves. It's yeah, I would say it's less important than other factors.
Love it. Great information. Let's move on to cortisol. Again, I'm trying to focus for the audience purposes on things you guys will know mostly, that you're like, oh, this is kind of more pop culture
Yeah.
discussions that maybe you've been fed a lot of information about it. And certainly cortisol levels have been a huge talking point in
Yeah.
stress. So let's dive deeper into that in terms of let's start first with this part, dispelling some aspects about cortisol production related to health and well-being, stress levels, weight loss, the whole deal with that.
Mm. So cortisol is a really important hormone. We actually can't live without it. People who don't produce hormone and cortisol have to take steroid hormones, otherwise they essentially die. They can't handle it if they get an infection in particular. Now, cortisol itself, similarly to thyroid hormone, so it's produced, the signal starts in the hypothalamus, goes to the pituitary, and then goes to the adrenal glands and produces cortisol. We produce cortisol every day. We typically have more in the morning, first thing when we wake up. It's a kind of, so it's important for lots of different things. It stops the immune system overreacting, so it's actually anti-inflammatory, which might surprise some people who think that cortisol is all bad and inflammation is all bad, but never is quite that simple. And it's important for regulating our blood pressure, which is probably why it's high in the morning. So it kind of allows us to get up out of bed and get up and do things. So really important just for sort of general life. And it sort of interacts with lots of other hormones. Now, we know that when you're exposed to stress, now be that intense exercise, pain, or psychological stress, you get extra cortisol being produced. Now, that can be predictive in lots of ways. And actually, we know that if you don't have enough cortisol, you actually can't handle stress. Like, for example, you couldn't handle being exposed to the cold for a long time, or you couldn't handle a really intense infection. So it's actually helps us a bit in our stress response. It in itself is not necessarily that harmful, apart from when you get it in high doses all the time. Now, part of that is because you imagine that because it's your stress hormone, right? So it's almost preparing you for action. So imagine you're walking across the African plains, you spot a tiger and you go, woof, I'll get a load of adrenaline, so my fight or flight kicks in. But also I'm getting a lot of longer acting cortisol, and it's mobilizing my body, getting it ready in case I need something. So it's essentially, it stops the action of insulin. So it stops you taking glucose from the bloodstream into the cells. Now, long term, that's obviously quite bad for your health, but short term, that's what you need if you're in a stressful situation, because you need lots of energy to be available for your brain in case you have to run all day from this tiger and you haven't got anywhere to stop. You can't eat anything. It also mobilizes amino acids in your bloodstream so that you can repair cells if you happen to injure yourself. So it's a very important mechanism, but because we are living in a time of excess stress, we're not very good at managing our stress. We are often in a constant state of having too much cortisol in our bloodstream. And because that affects things like our insulin levels and the action of insulin, it typically affects our weight. Okay, and you'll probably have heard that cortisol is really kind of instrumental in almost telling our bodies where to store fat.
Mm-hmm.
So the healthy fat, which I'm sure your listeners know about, is the subcutaneous fat. It's what's under our skin. We need that. It's important. It acts as our kind of fat reserve. But then you can also get fat, visceral fat, which collects around the organs and around the tummy. And that's typically less healthy. It has a much more kind of aggressive endocrine action and is often quite pro-inflammatory in itself. So we don't want visceral fat, but cortisol, high levels of cortisol, too much cortisol, will promote storage of fat around the tummy and make it harder to shift it as well.
I mean, awesome. I think the anti-inflammatory aspect of cortisol is going to be very surprising to a lot of people, but the prolonged exposure of cortisol, it sounds like what you're saying is ends up having a net negative effect in that area.
Has a net negative effect. Yeah, absolutely. And it's probably the hormone that is most under our control, I would say, because obviously the stresses that we put ourselves in, if doing lots of high intensity training or really intense exercise can increase our cortisol levels. So we have to be mindful of that if we're very stressed as well. And it's sort of something that I talk to my clients about, sort of balancing psychological stress with the stress that you're putting yourself under through other means. Obviously, exercise is really, really good for us, but it does create stress on our bodies, which causes cortisol release. So if you happen to be extremely stressed, I would say take it easy on your movement that day. It's something that you have to kind of balance what else is going on in your life, but it is under control for a lot of the time, even though we don't feel like it.
I would say that we don't feel like it part is I think I hear that the most from especially students who, at least the institutions I work at, the students are parents.
Mm,
They are going back to school, or they're younger parents, or they're taking care of family members, and they are under a tremendous amount of life stress. We'll put it
yeah.
this way,
Mm,
and struggle to balance that with
yeah.
the demands of school and family and all those things, and trying to get them to recognize that studying under this level of stress and learning information actually could be really counterproductive for that.
Yeah, it's pretty bad for your memory. And it makes you eat more. So, there's all sorts of negatives to it. And I can totally relate to that because I studied medicine as a graduate, which in this country is not that common. I know that you do that in the States all the time. But, financially, uh, stress related, it was massive. And I came across mindfulness when I was doing my medical training, and somebody recommended a book to me called Finding Peace in a Frantic World. And it was just the best thing I've come across. It's £10 that could potentially change your life if you're experiencing a lot of stress. And I actually went on to train as a mindfulness teacher off the back of that because I just think it's so great for helping us manage stress. And it's just really important for our health. And it doesn't take long. It's not something that you have to commit hours and hours to. It's
Yeah.
sort of 10 to 50 minutes a day and just a bit more awareness in your day-to-day life. But yeah, I can totally empathize with your students who are
Yeah.
experiencing that. But there are lots of things that we can do to reduce stress. We just have to make a choice that our health is more
Right.
important to us than whatever else is going on.
I'm going to throw a little bit of a curveball here. I know we didn't talk about this, but I don't, you're like, oh no, what's this? It's in the ballpark here, but um, in inflammation, a little more discussion on inflammation, and it seems like the current data are supporting or indicating that high levels of inflammation are at least currently an indication of like aging, a big biomarker for aging at this point. What have you seen about this? Have you experienced this, or have you talked to people about this? I'm just curious. Yeah.
It is quite interesting, actually, with the inflammation story, because this is what I was learning 20 years ago, and it was very, very new. But now everybody's talking about it. There's a lot of nuance that people don't necessarily understand. So there is a term called inflammaging. So we know that aging is related to some inflammatory processes in the body. That's true. We know that so inflammation is really important when we have an injury or an issue. We knock ourselves, and actually what we need is for the body to swell up, get red, get hot, and everything's coming in and it's
Cardinal
fixing
signs.
it.
Yeah, all that.
Yeah, exactly. So it's a really, again, like cortisol, it's an important thing. Sustained levels of low-grade inflammation are linked to a lot of chronic diseases, in particular our metabolic dysfunction. So type 2 diabetes, cardiovascular disease, neurodegenerative disease, you name it. The thing that most people don't know is that we don't actually have any way of measuring low-grade inflammation in your average human. It is extremely hard to do. In fact, we can mainly only do it in animal models because the very short-lived bits of inflammation just aren't detectable by most kind of assays that we have. And if you have really severe inflammation, it usually indicates something else is going on. So if we can do a blood test for inflammation, there's usually something else in the body that's causing that, an infection, a cyst, something is going on. If we have very small levels of inflammation that we can detect with something called high sensitivity CRP, C-reactive protein, then that can indicate an increased risk of heart disease, and we know that. But there's lots of other things that can cause that. And it's just quite an interesting topic because people are talking about inflammation. People feel like they're inflamed, but they've got nothing to base that with. And it's kind of fascinating to me because this is such an interesting part of my kind of academic life before I started medicine. And we don't really know very much about it. We know it's important. we can't really measure it. So it's impossible for you to know if you're inflamed at a low grade level. If you've got something massive going on, of course we will see that in blood tests. And I think all we can do is support the conditions that we know are associated with lower levels of inflammation. And often that is sort of eating the right sort of diet to support our gut microbiome. Doing exercise is really important, but also managing stress. That's one of the big potential drivers of low-grade inflammation. So I'm going to keep coming back to stress because I think it's just so important, and it's the one thing that most people just don't want to try and deal with.
Yeah. I feel like, at least in my experience through all these years, several decades now, is that people are more than willing to try a variety of different interventions, particularly for their health and well-being. But if you talk to someone like, hey, you really need to lower your stimuli, the amount of
Mm.
stimulus in your life that's causing you stress, it's almost like, well, what am I supposed to do? I mean, I have this busy life, I have this family and all these things. Something that feels like there can be control, but this weird resistance to
Yeah.
it. I mean, what do you think that is?
It's hard to say, and I think I have it myself, to be honest, because it's part of this busyness culture. I think we are conditioned to believe that our worth is related to our output or our productivity or how many views this podcast gets or how many views my little social clip that it gets. We are so conditioned to seek that level of kind of external validation that we forget that actually it doesn't matter a jot.
Yeah.
And on our deathbed, we are not going to be caring at all whether we did this or whether we worked hard enough or whether we started work on time, or we're going to be thinking, did I do the best I could by my family? Did I find some people that I loved in my life? Did I do the things that I wanted to do?
Yeah.
And I think it's extremely hard when you're trying to balance a career, particularly if you've got your own business or you're studying, or you don't really have that much money. You've got a lot of kind of financial pressure on you. You've got this time of your life where you feel I've got to make it now or never. But you're also quite aware that your health is only going to get worse.
Mm-hmm.
And I think something needs to shift with the way that we all think about this.
Yeah, I
And I
would agree
include
with that.
myself in this because I'm just, so aware on a day-to-day basis. If you track what you do, including other practices like exercise, meditation, and screen time, if you're feeling bad, I can almost guarantee it's because you're looking at your phone too much. Before bed, almost certainly, you're not getting out in nature, you're not doing enough exercise, and you're spending absolutely no time in stillness or in any kind of meditative practice, like, a hobby or something. And unfortunately, that's what most of us spend our time doing.
It's
Yeah.
interesting. I feel that, my practice, these are huge cornerstones of my business, gigantic, and
Mm.
something I've worked incredibly hard on throughout the last 25 years practice, and is a huge talking point among my
Mm.
clients. And I always say, listen, what we're doing with exercise, the physical aspect, it's important, but it's just the price of admission. And the deeper we
Mm.
go into these other areas, mindfulness, boundaries, lower stress,
Mm.
these are the things that are going to really change your life, and beyond the physical part, obviously. But it's going to give you a much fuller, richer, more relaxed life, honestly, for that.
Absolutely. But let's not forget that it does have impacts on our physical body. We know that mindfulness meditation decreases blood pressure. We know that it's got some effect in sort of cellular senescence, so our aging. We think there's something to do
Yeah.
with meditation and that. There's all sorts of data showing us that. I think, and I don't know if you've experienced this with your clients, I think people need permission to do things that feel nice for themselves.
It's so funny you mentioned that. I think people are hard on themselves if they feel like they're doing less or taking time to support their kind of holistic well-being. There's a guilt associated with that. And you have to, and I've done this plenty with people, and like just telling them it's okay to focus on yourself and to take time and just not be present with all this other stuff you have going on. And I was talking to my wife about this yesterday. I was like, it's very important to be selfish. I know this
Yeah.
sounds like, we've been told this is very negative to be selfish.
Mhm.
I'm actually bullish against that. That's very important to be selfish so that you are actually available for other people in a meaningful way for that. Because we often will
Absolutely.
take care of other people. We're caretakers for other people, especially family members, children, stuff, but we neglect our own well-being within that,
Mhm.
which actually becomes a net negative over time. Then the people who love and care for you start seeing that you can't actually take care of them and help them because your health is deteriorating. So it actually becomes a negative over time for that.
Yeah.
But it's very difficult to get people out of that thought process.
Yeah. I mean, I know that intrinsic places struggle, and I think there's also this sort of thing that we have in our mind that unless it's unpleasant in some way, it's not good for us. It's like actually zone 2 exercise is really good for you, but it's that hard, like compared to like a really intense spinning class.
Sure.
It's actually not that unpleasant. It's okay, but it's really good for us. But then we must resist doing it because it doesn't feel that hard, or
Yeah.
lots of really delicious food is really good for us, but we think, oh, can't be that good for you if it's delicious. I need to eat some, kale smoothie or something disgusting to feel like I'm doing something healthy. And I think the same, we're kind of quite masochistic, I think, with how we our lives, and it's to our detriment. I'm forgotten the quote because I read it a couple of days ago, but it was something like, "In all the busyness, I sort of forgot to live," or something
Yeah.
like that. And it's so poignant, isn't it? We can spend all of your life just doing bits and bobs and going through your to-do list, and then it usually takes something to happen, or somebody to get sick, or you to get sick, or a scare to kind of jolt you out of that. And I'd love it for people to not get to that point
Yeah.
before they started to say, actually, do you know what? I will be selfish. I will take just 10 minutes for myself today. It doesn't have to be all day. It's just little portions of time that you can give yourself during the day, and it makes all the difference.
100%. I want to be cognizant of our time here, your time. It's the audience. We're in a very large time difference. Dr. Merrifield's in
It's Friday night for
UK.
me, Ellen.
That's right. And my Friday night will be beginning eventually. But I want to talk a topic that also gets discussed with my clients quite a bit, and just general conversation in the larger health and well-being field, in particular testosterone and estrogen. But let's start from the estrogen point of view in terms of hormone replacement therapy and menopause, and where are we at with the data in terms of more pro HRT, or are we in maybe more the past idea of this?
I would say we're probably moving towards pro HRT. I think it's a bit of a slow process, partially because the trials have been done on some of the older preparations of HRT, but now we've got better HRT around, and certainly some of the big names in menopause have really convinced me, like Louise Newson. I don't know if you know her. But I'm really thoroughly convinced and will be taking HRT myself, unless I happen to sail through the menopause without noticing that it happened. So I think overwhelmingly pro, and I think what's happening at the moment is there's a lot of more awareness of all of the negative effects of menopause that aren't just hot flushes. That would be the only thing that you'd ever talk about 10, 15 years ago. Whereas now, I think people are realizing the really quite detrimental effect on mental health that women experience as their estrogen levels kind of fluctuate, particularly around perimenopause. Now, actually, postmenopausal women are less likely to be depressed. So it's not all about estrogen either being there or not, but I think there's certainly around that transition, that kind of fluctuation can really play havoc with memory, our kind of sense of well-being, and causes a lot of vulnerability in people who are sort of getting to a stage of life where they want to be, finally enjoying the fruits of their labors and kind of enjoying life a bit more. So I'm pretty pro it personally. And I think the new preparations are really very safe, and there's a lot of ways to take it that you can kind of titrate to your symptoms and get a lot of relief. So it's a good thing, in my
I'm
opinion.
seeing that too, like more of this consensus and academic and medical consensus and pro HRT. What about for testosterone? I haven't heard as much about this for men at different ages.
I think it's a difficult one because so testosterone testing is an interesting one actually because it's, I think, what was the statistic? It's something like 1 in 4 men over 40 have got low testosterone, 1 in 5, something like that. So quite a high percentage of people. But we know that testosterone is actually one of the hormones that's very sensitive to your lifestyle. So if you're not sleeping, if you're very stressed, if you're not eating well, if you're not moving, that will all contribute to low testosterone. So those are the first things that you can sort of work on to improve testosterone levels. I would say that in people who have genuinely low testosterone because of a central problem with the brain producing it, or have the sort of proper endocrine reasons why they don't have it, testosterone replacement can be absolutely life-changing. And I've sort of seen that a lot at particularly sexual health kind of conferences where we've had people speaking about their experience with it. And it's slightly an under-recognized thing because we don't always test for it. It's something that men are often a little bit embarrassed about talking to doctors about if they don't have a low libido, which is obviously one of the main kind of symptoms of a low testosterone. So it's often something that people don't mention, so they don't necessarily seek treatment as much as they could and should. But it certainly improves the quality of life in men who need it.
Awesome. I think we could spend literally hours going over all this stuff. I always have tons of questions about stuff like this, but I am so grateful that you've given me some of your time. And I know that my colleagues, students at various universities, and clients as well are going to greatly appreciate this. Thank you so much, Dr. Merrifield, for giving me your time. Seriously, this was a wonderful deal.
Oh, thank you. I really appreciate you having me on, and it was a real pleasure to speak to you.
Most definitely. And you have to get to your Friday night. You know, the kids are bedtime. You got to enjoy yourself. I know, we know what that's like.
Yeah,
for that.
got to get my beauty sleep in.
Got to get your beauty sleep in. Yeah.
Thank you so much, Dad. Really appreciate it. Enjoy the rest of your day.
Yeah, you too. I appreciate you. Thanks a lot.
Thanks so much. Bye-bye.